Welcome, bienvenue. My name is Erica Phipps, and I have the pleasure of serving as Executive Director of the Canadian Partnership for Children's Health and Environment, or CIPCHE. CIPCHE is a national collaboration of organizations with overlapping missions and a shared commitment to ensuring that all children in Canada have healthy and sustainable environments in which to live, learn, play, and grow. Through the collective efforts and expertise of our partners and affiliates, and often in concert with others, we mobilize awareness building and advocacy efforts to protect children from the harmful effects of toxic chemicals, pollution, and the escalating effects of climate change. We've got a really exciting lineup of speakers for today's session on radon, but before I introduce them, I would like to acknowledge that our collective work takes place on Indigenous traditional territories that stretch from coast to coast to coast across Turtle Island. As organizations and individuals dedicated to environmental health, we are deeply grateful to Indigenous peoples for their ongoing stewardship of these lands since time immemorial. We recognize that we are on a journey of reconciliation and are committed to listening, learning, and working to decolonize our collaborative efforts towards the goal of healthy and sustainable environments for all children. In 2017, CIPCHE took on the leadership of what was then called Healthy Schools Day in Canada, which we have since rebranded as Healthy Environments for Learning Day, or HELD, in order to be inclusive not only of schools, but also childcare settings. Our very first campaign in 2018 was on radon, at a time when radon awareness was still very low and not much was being done, at least not systematically, to ensure that radon levels in educational settings were acceptable. Since that time, and even before that time, many people have been working over many years to promote the importance of radon testing in schools and childcare settings. And some of the most influential are among them are with us for today's session. So I'm really thrilled that Radon is the first in our series of national speakers events that we're hosting in the lead up to Healthy Environments for Learning Day, which will be on April 25th. This 4-part speaker series is an opportunity to share practical information and on-the-ground experience related to indoor air quality issues in schools and childcare settings, which is the theme of this year's HELD campaign. I'm joined in hosting this webinar by my colleagues, my CIPCHE colleagues, Flora Aldridge, who's the HELD coordinator, Helen Doyle, as well as April Wepler with CELA, the Canadian Environmental Law Association, which is a founding CIPCHE partner and the lead organization for this year's HELD campaign. I'd also like to gratefully acknowledge the financial support from Health Canada and the Rafi Foundation for Child Honoring for CIPCHE's HELD initiative. So I want to briefly introduce our fantastic speakers, starting off with Kelly Bush. Many of you know Kelly. She has been the manager of the National Radon Outreach Program at Health Canada since 2008. She's going to get us started this afternoon with basic information on radon, its health risks, and the importance of radon testing and remediation. Following Kelly, we'll have a chance for some short questions on the information she's shared, and then we'll move on to our other panelists, starting with Jim Sinnott, who's the Director of Facilities and Custodial Management of Newfoundland Schools, who will be sharing his experience with radon testing in schools. Following Jim, we'll have Greg Baytalan, who is a Specialist Environmental Health Officer at BC's Interior Health Authority. He has been a steadfast champion of radon testing in childcare settings and schools for over 17 years. And following Greg, we will have Elise Azar, who is the School Safety Consultant with the Public Schools Branch in PEI, who has been overseeing the ongoing radon testing in PEI schools. So we have, as you can tell, a wealth of radon expertise as well as practical experience in the challenging but very important work of testing and, where necessary, remediating educational settings for this carcinogenic gas that can build up to harmful levels indoors. We have an hour today. We'll try to end at the top of the hour at 3 o'clock Eastern. And the last section of our webinar, following the panelists, will have plenty of time for your questions and experiences. We invite you to start off our session today by introducing yourself, if you wish, in the chat. And as we go through the session, if there are questions or observations you'd like to share, please put those in the Q&A, and we'll refer to those towards the end and engage in what I'm sure will be a very fruitful conversation about radon and the need to test educational settings in Canada, and drawing upon the experience that we've got with us in our virtual room today. If we are not able to get to all of the questions, we'll try to follow up. And I do know that our speakers are available to stay on a little bit after the hour if that proves to be necessary. With respect to the Q&A, you may also post questions in English or French, the language of your preference, but just noting that all of the presentations themselves will be offered in English. We will be posting a version with French subtitles on the Kipchi website thereafter. So without further ado, I would like to invite our dear colleague and friend, Kelly Bush, to start us off with an overview of radon and its importance.
Hello, everyone. Good afternoon. I should start by saying, making sure you can see the slide. Thumbs up, Erica. I know you just turned your camera off. Okay, we're good? Okay, awesome. So I'm very happy to be with you here today. Thank you so much for taking time to join us. Let's see if I can make this work. So let's start with the basics. What is radon? Radon is a radioactive gas that comes from the breakdown of uranium in the ground. You cannot see or smell radon gas. And the gas itself, just by nature of being a gas, can move very easily from the ground, and it either escapes outside and gets diluted and mixed with outdoor air, or it finds its way into buildings and homes where it can accumulate to high levels and, as Erica said, become a health risk. So I like to start by talking a little bit about different radiation types in our exposure. So we're exposed to radiation via natural and man-made sources. There are 4 major sources of natural radiation that we're exposed to: cosmic, terrestrial, inhalation and ingestion. And then there are also 4 categories of artificial or man-made sources of radiation. There's 1, atmospheric testing of atomic weapons; medical sources like X-rays and CTs; industrial sources like density gauges and smoke detectors and glow-in-the-dark signs that have radiation in them; and then nuclear power plants that we're likely a little more familiar with. So of all of these sources, both natural and man-made, it's estimated that radon represents almost 50% of a person's lifetime radiation exposure. This is why it's important to know about radon and take action to reduce your exposure to it. So let's start the Canadian Radon Guideline. The Canadian Radon Guideline recommends that radon reduction action should be taken in a building whenever the average annual radon concentration exceeds 200 becquerels per cubic meter. This Canadian guideline was established by Health Canada in collaboration with our federal, provincial, territorial radiation protection committee. The guideline applies to homes and buildings where the public spends 4 hours or more a day, so absolutely applies to schools and daycares. The higher the radon concentration, the sooner action should be taken to reduce the radon levels. And there is no safe level of radon. While the health risk below the guideline is low, there remains a risk at any level of exposure. So how does radon get into a building? You can see by the image on the slide that's still building that there are many different ways that radon can enter a building. All buildings in contact with the ground will have some level of radon in them. So it's never a question of whether or not you have radon. You test to know how much radon that you have. There are several factors that influence how much radon seeps into a building: the amount of uranium in the ground, the building construction type, the ventilation system, and then how we use and live in that building, how many doors and windows we have open, all impact the amount of radon that accumulates in the building. And radon can move, as I said earlier, because it's a gas, it can move easily from the ground into our homes through any small opening it can find, such as cracks and gaps in the foundation floor, around pipes, and through sumps. So what's the health impact? Radon is recognized by international authorities and experts as the leading cause of lung cancer in non-smokers, the second leading cause after smoking. Lung cancer in Canada is the most common cancer, and the survival rate is low. It's less than 20%. So testing and reducing your radon exposure is the best way to reduce your long-term risk of lung cancer if you don't smoke. And smokers also exposed to radon have a significantly increased risk of lung cancer. So very important to quit smoking and also to test and reduce your exposure to radon. We estimate, Health Canada estimates that more than 3,000 lung cancer deaths a year are radon induced. That's equivalent to more than 8 people a day. Radon is a very significant but preventable health risk. So what you see on the slide now is our radon risk map of Canada, and it's based on current radon data. It's estimated that approximately 7 to 10% of homes in Canada have high radon. That in and of itself is significant, but really the challenge and the important message is that that percentage varies quite significantly across the country, with some areas estimated to have as much as 40 to 50% of buildings with high radon. So whether you live in an area with low or high radon, or if you know your neighbor tested and had low or high radon, you cannot predict or know what the radon level is going to be in your own home, in your daycare, in your school, unless you do a test. And as you can see on the map, there are no areas of Canada that are radon free. The red to pink color scheme was specifically chosen to communicate that there's risk in all parts of Canada, and it supports our recommendation and message that all buildings should be tested and mitigated if the radon levels are found to be high. So I wanted to talk a little bit about the radon levels in different buildings. Health Canada scientists have done significant research to understand the risk of radon in Canada. Over our lifetime, we will spend the majority of our time indoors at home. So testing and reducing our homes is very important, as it's our most significant source of exposure. That being said, testing and reducing in schools and daycares is very important as well. Radon exposure is cumulative. Research has shown that short-term exposure to high radon at a young age can be equivalent to a lifetime exposure at or above the guideline level. Children have more life left to live. Reducing exposure early is important preventative action to reduce their long-term risk of lung cancer later in life. So I've mentioned a couple of times that the only way to know is to test. And the other important message I've mentioned is needing to reduce if the levels are high. So how do you do that? So testing can be done easily, either by purchasing radon detectors and doing it yourself, or hiring a certified professional to do it for you. Health Canada has detailed guidance for testing in public buildings, such as schools and daycares. So there's resources available. You're not expected to figure this out on your own. The first step is to visit our Health Canada radon web pages or to visit takeactiononradon.ca. Both are really good sources of information about radon testing and where you can source approved and certified radon test kits and professionals. If the radon level in a home or a building is high, it can be fixed. This is such a powerful and important message because a lot of people, it's a barrier. They choose to try to ignore or not want to take action on radon because they assume it can't be fixed or it's too complicated or it's too expensive. And that's absolutely not the case. Techniques to lower radon levels are effective and can save lives. Radon levels in most buildings can be reduced by more than 90%. The most effective radon reduction method is called active soil depressurization, and there's an image of it on the slide. This method involves installing a pipe through the foundation floor that leads outside of the building, either at ground level or at roofline, with a fan attached. And what that system does is it draws the radon gas from below the building and exhausts it to the outside before it can enter. In schools, there are other options that I'm sure will be discussed, such as changes to the ventilation system that can also help reduce radon levels. So that is the end of my slides for me. I will reiterate some key messages and I'm happy to answer some questions. Just a reminder, radioactive gas invisible to the senses in every building that's in contact with the ground, can be easily tested and can be reduced, and is very much taking those actions will help you prevent your long-term risk of lung cancer. And lung cancer is today, unfortunately, not easily prevented or cured, right? It has, unfortunately, is too often detected late. So really, this is one of the best ways to reduce your risk. I'll stop there.
Thank you so much, Kelly. So before we move into the other parts of the panel who are going to be speaking about experience, we want to make sure everyone has the basic knowledge about radon. So if there are any quick questions about the information that Kelly shared, we can take those now. If you have questions about testing approaches and the experience of what that's like in terms of the on-the-ground experiences of those on the panel, let's hold those to the end. But if there's any question about radon, what it is, health effects, those sorts of things, let's take those now. And Flora, I'm going to lean on you to see if there's anything of that type popping up in our question and answer box.
Yes. There, I'm just reading the Q&A. So if you have any questions, yeah, just pop them in the Q&A.
Yeah, I see the one. Yeah, there are some funding programs. The third one, which is a little bit more of a general question. There are some grants or funding programs that are available, not nearly as many as we would like. The Canadian Lung Association has one entitled Lungs Matter. It's available to low to medium income Canadians, and I can share that link. I'll put it into, I'll type it into the chat afterwards.
Great. Kelly, we're also seeing a question about the radon guideline limit of 200 becquerels per meter cubed. Maybe you want to take that one. I think the other question is more about residential testing. So I think in the interest of time, following the radon limit question, we'll move then into the panel.
Oh, and it looks like Greg is typing an answer, which is great. Thanks, Greg. Generally, we get this question a lot. And that's when I was speaking about the guideline, that's when I spoke to, it's important to understand that you don't get to 199 or 200 and it's safe, right? The risk below the guideline level is lower, but there continues to be a risk, and it's a guideline. It's at this point in time, it's not enforceable, except for under the, totally blanking right now. It'll come back to me, but it's only for federal buildings. The Canada Labor Code, CLC. So it's ultimately, we make decisions on risks and what our risk tolerance is for different things. We have different priorities and different situations in all of our lives. So it's ultimately a choice, but it's important for people to know that at 199, it doesn't mean that it's safe. And certainly we know people who test below the guideline and still choose to mitigate, and those that test just above it, and their perception is, well, it's pretty close, so I'll just leave it. And you know, I think I made it clear about what the risks are, and ultimately, the lower the level that you're exposed to, the more you're preventing and reducing your risk of lung cancer later in life.
Great. So before we pass it over to Jim Sinnott from Newfoundland, I just want to comment about what an interesting group of folks we have online. I know this is a very well attended webinar, and we have people not only from all the way across Canada, but also multiple folks joining us from the US and probably elsewhere as well. I couldn't read them all. So welcome, everyone. Really glad to have this, robust participation in today's session. So Jim, over to you. And I believe we have some slides coming up.
Thank you.
Seeing the slides, are you?
Yes, we are.
Switch to the first one if you'd like. There we go. So the on-ramp for us in Newfoundland and Labrador for school testing really came from a Health Canada project. There's a mining town of St. Lawrence that Health Canada did a project where they tested almost all public buildings, I believe, and did a lot of marketing towards people getting their housing tested. And at that point, no schools in the province had been tested. And the school in St. Lawrence, first called St. Lawrence Academy, tested high. So I connected with an industrial hygienist in government at the time, and although there was no particular focus to do so, we decided, okay, let's try to do all the schools in the province. And we connected with Lance and Allison from Health Canada, who were very helpful in this. And we said, oh, hey, look, we'll do it over a 2-year period. So we began by doing some training with all my facilities managers. So I had everybody from across the province come in, and Lance and Ellison came down and did some training with us to make sure that we knew essentially what we were going to be doing in terms of testing and what we were going to have to do afterwards. And we started with about 1/4 of the schools. And at that point, we also engaged with our provincial regulator. And as was just said, there is no particular regulation right now that requires radon testing, but we just decided we would loop them in right at the beginning, which actually was beneficial to us later on. Okay, switch slides, please. So this was our first school. You can see on the left, I make fun of myself and say we were highly technical with our Microsoft Paint, but this was a good demonstration for us with the hygienist, and we were able to send this image around the province to just give people the kind of the breakdown of where you would go for doing mitigation. So at this school, we went in and did a lot of testing, first of all, with the ventilation system to lower the radon that people were then breathing day in and day out before we did mitigation, and also plan for the mitigation. So the slide on, or sorry, the picture on the left is our planning job, and on the right was when we finished the mitigation. Okay, next slide. Thank you. So in year 1 of the 67 schools that we tested, 10 of them had elevated levels. We had expected, and this is not based on any insight and knowledge, just what we hypothesized, is that we were going to have geographic clusters. But in keeping with what we were just told, there was no real geographic cluster. It was just sporadic. The 67 schools, and I chose them from all across the province. We just had a smattering of people who had elevated levels. We decided at the outset that we would communicate the results to all the parents and guardians in every school. So we didn't focus in on particular rooms or particular floors or anything like that. We decided we would communicate with everybody. And then again, the industrial hygienist that I had connected with first guided us through the mitigation on all of these sites. And although we had 2 years as our window of opportunity for most of these, because most of them were under 600, we decided we would do them obviously as fast as we could. So we aimed to do them in like a 3 to 6 month period. In year 2, it was a lot steeper year. We did the remaining 3/4 of the provincial schools, as well as retesting the sites that we had done mitigation on in the previous years. And of the 3/4, 48 of those had exceedances. And what we found in our first year communication plan, a lot of the questions that came back, and I was made the point of contact for all the parents. So I took the most common questions that I had asked the previous year, and we refined our communication plan so that we could answer the questions for people up front. And we did note in this case some geographic clusters, particularly on the west coast of the province, which was where Health Canada had told us earlier that we would probably see higher levels. And we did engage public health at that point as well to see if they wanted to do any communication to the public at large. In terms of mitigation, we bought the device you picture on the left called the Radon Eye. They were approximately $200 each. And what we found with those is we were able to go into a building where our Alpha Track had told us we had a problem and see if we could replicate the problem. And this was really a learning curve for us, because in some of the cases we went in and it looked like we had no problem. And we discovered it was just the way our ventilation system was already programmed to work, meant that during the day when staff were in there doing the radon eye testing, the radon levels were low because the ventilation system was keeping it low, but it was building up overnight, which obviously the Alpha Track devices would pick up. So that informed our mitigation a little bit better. And we also obviously chose all the best place for our fans so that we could have the mitigation in place, but we didn't have pipes running up to the middle of a classroom. So obviously there's always an aesthetic aspect to doing any work in a building. I would say we spent more effort and more time on communication than we actually did on mitigation. So when people begin to do any reading of radon and it talks about lung cancer and it talks about the seriousness of it, obviously it creates clusters of concern. Again, I want to give a shout out to Health Canada in this. Rashini from Health Canada was extremely helpful to me. If people were asking questions that I wasn't sure of or anything like that, I could go back to Rashini all the time. We also got a lot of criticism, which is something that we always expect in the public sector. But first of all, was a curious communication, or sorry, a curious complaint was that we over communicated. So the way that we would do it, even if only 1 or 2 rooms in a school tested high, we sent the communication to all the parents and guardians. And we found that some people thought that we shouldn't have done that. They thought we should have just tailored our communication. But our strategy was, if there's a problem in a building, we don't want to be second guessing who is or is not going to be in any particular room that tested high. So we just wanted to over communicate on purpose. Second criticism was the opposite of that, that we under communicated because everybody assumed that there was going to be a report. So a lot of people said, we know that you would have hired a consultant and you'd have a report. We want to see the report. And we hadn't actually done that. We just used the AlphaTrack devices, which then shipped to the lab, and the lab gave us back our results, and the results indicated how we did mitigation. So there was a lot of back and forth on that, where people expected that we would have more comprehensive reports instead of just the tabular data on the schools. We also had a lot of people asking how long have the levels been high, and there's no way to answer that because the schools in the province hadn't been tested before. So if we do another round of testing in another year or two, then we can go back to previous results. But at that point that we were engaged, we had nothing to refer back to. There was a lot of people asking why we tested. They presumed that we knew there was a problem. But again, I'm going to say that we essentially bought into Health Canada telling us that testing was the thing that we should do, and we did it. The other is a minor school year event. The timing of the release for us was immediate, but because we would test during the winter and then we would send the devices off to the lab, by the time the lab got the results back to us, it tended to be late summer. So again, we had a criticism from some people. In the first week or 2 of school, we were telling them that there was a problem, and everybody wanted to know why we hadn't already fixed it in July and August. We didn't know about the issue until we had the results. So the learnings that I would say that were in this province that could be helpful for other provinces, first of all, the cost of mitigation was not prohibitive. And I think a lot of times when you test things in the public sector and you test things in your home, you're always worried about what the cost is going to be. We're perhaps in an enviable position that we have trade staff already. So we have staff that are maintaining schools, and we just had to give them the little bit of training on what we wanted them to do. But somebody, a plumber who's already running pipes or an electrician who's already running wires, there was nothing unique about the radon mitigation. So our labor costs were very controllable, and the materials cost. We also had access to somebody with knowledge. So if you didn't have that, that would bump up the cost a little bit. But again, I'm going to say that we were surprised by how economical it was. Mitigation was never a question for us, that we wanted to do it, but it wouldn't be affordable to do. Cost ended up not really being a factor. The other learning for me in particular, because I'm involved in a lot of new school construction, is the consultant community, the architects and the engineers. I can't count how many times it was said to me, you don't need radon mitigation in new buildings. Radon is not a problem in Newfoundland and Labrador. So really that speaks to what Health Canada is doing right now and trying to communicate and make people aware of this. And each of these people were speaking with an honest belief, but they were wrong. So any new school that's built now has a radon mitigation system up front. So that was our experience.
Great. Thank you so much, Jim. And I'm really glad that you focused on the communications issues and that transparency, as well as speaking to some of the concerns that that I'm sure lots have about the cost and challenge of the mitigation. So we're going to jump to the opposite side of Canada and invite Greg Baitalan to speak about radon testing in both schools and childcare in BC's interior. Over to you, Greg.
Good morning, or should I say good afternoon? Is everything working okay here?
Yes, looks good.
Great. Okay. So I'm going to just go through a few slides here really quick in the few minutes I have. So where we were, where we are now, what we learned, and where we should be going. Next slide, please. This is an example, and I don't expect anybody to read this fine print, but I provided it in case these slides are made available and somebody wants to get into it and dissect it a little bit. But my point here is this is some screening that was conducted back in the 90s, the early 90s, and this report was 1998. And it was by BC CDC, or BC Center for Disease Control. And this is nothing new. We've known about radon for decades now, and these are school test results from a mere screening, and there's some pretty interesting levels there. Next slide, please. This is a school, a 1908 school, which is no longer school. It's a public museum type building, and it was one of the first schools in the interior BC to be mitigated. And this is in a town, Peachland, where 25 something odd years ago, a building official there told me, we don't have a radon issue in Peachland. Oh, sorry, you do. Anyway, the nearby houses, and this is another thing, when you test a school, this is why I'm such an advocate of openness and transparency to parents and teachers. When you test a school, if it's high, you know, in all likeliness, there's a few houses and basement suites within the area that are also high. And everybody should test, regardless of whether your neighbor is high or what or whoever. You don't know until you test. Next slide, please. So what has come up more recently than the last like 30 years ago is there's been some very more detailed research and information come forward. And 20.3% of the residential properties in Canada are above the Canadian guideline of 200 becquerels per meter cubed, but 47.5% is at or above the WHO reference level of 100. Radiation exposure and damage to lung cell tissue is linear. It's not like there's a hard line in the sand that 100, you need to go screaming and running off to your doctor, but 99 is okay. Or because we're in Canada, 200, you go to the doctor, but I'm okay at 199. It doesn't work that way. The longer the exposure, the higher the dose or radiation and the longer exposure, it's cumulative, as Kelly said earlier. The epidemiologists will say that there's way more people getting lung cancer from low levels of radon than high, because an extremely more amount of people are exposed to low levels. Does this mean that we shouldn't worry about high levels? No. You want to get the high levels down to as low as you can reasonably achieve below the appreciable guideline. And what is known, certainly, is BC Interior has some known hotspots. Next slide, please. So this is a map of the BC CDC interactive map. If you Google it, it's really interesting. The interior, which I work with the Interior Health Authority, and we cover the interior zone. None of our geography touches saltwater, but certainly if you go to the south, the USA border, if you Google USA EPA radon zone maps, it's all red, zone 1 right below us. And this is definitely a concern that the BC interior is considered to have to be a concerning area and have hotspots. Next slide, please. So Kelly touched on some of this in her slides. Children are important from a biological aspect, smaller body mass, rapidly replicating cells. They breathe faster than adults, and they have many more years left to live, where the damage from radiation can have time to turn into potentially genetic mutations and lung cancer. More recently, 2017, the International Commission of Radiological Protection, publication 137, they've doubled to quadrupling the radiation dose factor from previous years of what was expected. The guidelines that you've heard here, the WHO, the Canadian guideline, the USA EP action level, they were all made before this 2017 publication 137. And yes, exposure in a school from kindergarten through to grade 8 that's high could definitely be a increased lung cancer risk for children into adult life. Next slide, please. So what we did in IH, we had some partnership, worked with Health Canada on a project, a radon awareness agreement project. And what we did is we we supplied daycares with detectors. And at that time in 2017, IH had 840 daycares or childcare facilities we licensed. And in 2017, this project actually occurred in 2014, but by the time we had this newsletter by 2017, we made it mandatory that all child care facilities test for radon as part of their license. We don't actually hold a license up for testing, but we want the 3-month, the 91-day winter season alpha track puck test in the daycare. And we had a voluntary uptake of 47% of people running daycares took advantage of our free detector. And there's the, no surprise, the results that we got there. Next slide, please. School environments can vary hugely. That school in the top is just down the road from where I'm sitting right now here in Kelowna. It's brand new solar collectors, but yes, there's portables outside, and it's amazing how many portables have tested high. Small little one bedroom or one or two room schools. Next slide. And we have a huge inventory. We don't even know how many buildings, but I'll leave this for folks to read. Next slide, please. And our goal is to not make our school testing project a one-off. We want this to be a provincial initiative and get radon on the routine indoor air quality agenda for school maintenance. Next slide. The intervention ladder, there it is. Do nothing right up through mandates and orders. And I'm an advocate for let's move this on to getting it more of a requirement rather than this voluntary testing, voluntary openness and transparency and so on. But I'm just one voice in the scene here. Next. I won't get through this. I see Erica's want me to wrap up here, so I will ask for the next slide. That is a really interesting picture. That's alpha track. That's alpha radiation pits on a piece of plastic in a radon detector, and that's what it does to your lungs. Similar. Next slide. That's me beside my home mitigation system and do-it-yourself system that worked just great. And thanks, everybody. Sorry if I went over a touch. Thank you.
Thanks so much, Greg. And thank you for really underscoring the importance of addressing radon from a child health perspective, which is, of course, what brings us together in this work to advance radon testing as part of our Healthy Environments for Learning campaign. So we are now going to move over to Elise, who is joining us from PEI, and similarly sharing the practical experience of what it takes and how you go about getting schools tested. Elise, over to you.
All right, hi everyone. I'm Elise with the Public Schools branch in Prince Edward Island. And I don't have a whole lot. I just have a couple slides to go through. I just kind of wanted to kind of put it out there and just let everyone know how we went about as public schools branch in Prince Edward Island, how we went about the testing. So we began conversations with Roshini, and there was just an area that was tested at one of the schools. And so we kind of got to talking and basically, as a collaborative effort, decided we have close to 60 schools here in Prince Edward Island. So we decided we'll break it up and do 20 over a 3-year period, approximately. So we had done that again with the collaborative effort of Health Canada. So we had ordered the detectors. We also had sort of created notifications to provide the staff on the fact that we were going about conducting the testing, and then also basically a notice to be sent home to say, okay, the testing is going to be carried out over the next 3 months. Just here's what you need to know about radon. And we also highly encourage the testing in homes through those communications. So I just have a little example on the next slide, just what those communications looked like. Additional to that, the CBC had also kind of reached out and just wanted to do some interviews with the school, with the board, just to kind of say kind of what prompted this testing and just kind of reiterate the importance of the testing, and again of testing at homes in addition to the schools or other public buildings. Following when we received the results, we had, this is for last year, we had 4 out of the 20 that had some elevated readings. They were all well under the 600, but we did go about, what we did on our end was we reached out to an external contractor who specializes in mitigation, and basically worked to collaborate with them to basically kind of come up with the mitigation plan. So that's just kind of one example down here. One of the mitigation systems that we have in the schools. We were able to mitigate the 2 schools within a couple of months, 2 of the 4 schools within a couple of months of receiving the results. The other 2, the plan is to do that this kind of spring and summer. So in the interim, what we had done was we had purchased just an example down here, just kind of the continuous monitor. And what we did was we placed several of those in the schools, and we manipulated the mechanical ventilation systems so that we were introducing extra supply air into those areas, and we were able to we are still continually monitoring those spaces and making sure that the levels remain well within limits. So we've just received results back actually from the second set of testing. So now we've got basically 40 tested altogether, and we luckily didn't have elevations this year, anything above the requirements. However, we'll continue this cycle over the next, we'll basically continue it year over year, kind of in the same sequence, just to make sure that results remain the same and remain lower than required. Additionally, just as Jim had mentioned also earlier, we do have any new builds, we do have a mitigation system, a passive system installed as well, so that in case that, again, in case we do have to initiate or use it in the future, then at least it's already installed. Yeah, so no, it's been great. We've had a lot of support from Health Canada. They've been a great group to work with. Again, we'll be continuing on next year, so hopefully things continue to work well that way. So thank you. That's really all I have from our end.
Really great. Elise, thank you so much. And thank you for sharing some of the practical details, including your letters to families. For those of you who may be joining from the childcare sector, KIPSHE has sample letters online for informing parents about the radon testing and either the above guideline or the below guideline notification letters. So those are available. And thank you, Elise, for sharing yours. And I love the little sticker on your radon test device. So thank you for sharing also your stepwise approach. We are now going to shift into our Q&A, and I know that there have been lots of questions bubbling up in the Q&A box, and thank you panelists for already starting to answer those. Before we shift into open Q&A, I do want to acknowledge that sometimes the real driver behind a radon testing effort, and certainly radon advocacy, are parents, families who are concerned, who learn about radon and want to make sure that the place where their children are spending 6 to 8 hours a day, or sometimes more, have acceptable levels of radon. So to kick us off in our Q&A, I wanted to pass the word over to Helena Younger, who reached out to KIPSI because she is a parent who is concerned about radon. Just to share from your perspective as a parent, the importance of radon testing and some of the, certainly it's a challenging thing in some cases. So over to you, Helena, and then we'll move into a panel discussion with the Q&A.
Hi, everyone. Thank you so much for having me. And I'm just quickly, I know we're running a little bit late. I'm just quickly going to share this journey I had when I was trying to get our daycare to test for radon. So we had tested our home a few years back, and luckily everything was okay. And when our daughter started daycare, I realized, oh, it's in an older building and at a lower level, 2 risk factors for radon. So I reached out to see if they had tested or were willing to test, and I provided a lot of information, all the sources of some of the sources that I had read up on from the WHO, Health Canada, and KIPSI. And I also provided information on how easy it would be to test and to fix if high levels would be found. And I even offered to donate a test. I thought, I try everything to convince them and make it look not so hard as it probably does in the beginning. The daycare then consulted with their landlord, with other school principals, supervisors of other childcare facilities, and the Ministry of Education rep, and said, quote, that after careful consideration, they decided not to pursue radon testing as their practices were in compliance with current standards. So then I reached out to city officials. I found Erica at KIPSI, and I also try to advocate among the other parents, but the problem is that a lot of people have never heard of radon. And so there was some interest, but it was just not enough volume. And from the city's contacts, I just kept hearing that it's not required, so there's not really much you can do. Our daycare also mentioned that there are so many sources of potential harm, air pollution, or some parents were concerned about Wi-Fi and all these things, and we can never take care of all of them. And I said, yeah, but radon is something we can easily test for. It's been proven to be harmful, and we can actually do something about it very easily. So why don't we just do the right thing and test for it, because it's going to be required hopefully at some point. And I was like, hey, and then you can advertise, we tested for radon, and even if the levels are low, that's great. But I guess I was hoping that them being a daycare, they would just do the right thing, because their job is to protect our children, but they're also business. And if it's not required, then they might not want to go through the trouble of extra complications and expenses and so on and so forth. So I really do need that. We do need I really think we need a policy change. And I think we also need places where parents can advocate, because I also found myself looking for places where some politician or some officials would hear my voice or the voice of parents that are concerned, and I really couldn't find any. So that was very disappointing. So yeah, I'm hoping this will all improve at some point soon. Thank you so much for having me.
Yes, thank you so much, Helena, for sharing your story and for joining into our campaign. Helena's part of our advisory group on this, and clearly keen to advocate. So I just want to reflect in childcare, it's an area we've been working for a number of years to try to build that all-important awareness and support for action. But of course, also have come to the conclusion that voluntary probably isn't going to make it. Not all of these spaces are going to have the wherewithal or the intention. So when we did a survey last year with the Canadian Childcare Federation, one of our core KIPSI partners, we asked about radon testing, and of the 2,000 childcare professionals who responded, they indicated that there were only 20% who had said that their facility had been tested. So still many miles to go in terms of that awareness building and getting testing happening. So I noticed that Teresa from the Canadian Environmental Law Association, Executive Director, has joined us, and I know others in the room are knowledgeable. So either now or at some point over the next 10 minutes, if we can engage in the question that Helena has indirectly put before us, which is what are those policy levers? What policy tools are out there that communities and parents and others can use to leverage in order to get that radon testing happening? I know that in the case of Greg in Interior BC, the existing public health statute was the lever that Greg courageously used to start that testing in childcare programs. So panelists, I would invite you to turn your cameras on if you wish. And if there's anybody who wants to speak, to that question of policy levers, and or how to get some of this testing mobilized. Let's start there, and then we will move to some of the questions that Flora will share with us from the Q&A box. Any takers on that question of how to leverage? Where are the advocacy points for these issues?
That's a tough one. Someone did ask, and I wrote the answer about, I misunderstood the grant question. It was about testing in schools. And so there aren't any grant programs for testing in schools. That being said, I think you can tell by the panelist discussion that we certainly are encouraging testing in schools. We have resources, and we do support initiating testing programs in schools and daycares. We cannot fund full testing programs, but we can provide some financial support for testing in schools to get you started to figure out what the process is. And I think Jim and Elise and Greg have sort of spoken to, once you get it started, you can make a plan, you can do it over multiple years. It doesn't have to be a huge cost in a short period of time. And we found by supporting piloting of this that schools and daycares take on the responsibility to create a broader plan to address it across their province. Easier when the province is a little smaller, I guess, but we're seeing that across the country. So we do have radon action guides that detail legal and ethical responsibility on a number of issues related to radon, including testing in public buildings and schools. So there's some good resources and information there that I can share the link to as well. But Greg, you can speak to how the motivation has changed over the years, but each province is a little different with regards to what the lever is and the timing and the relationship. And there's not a number of factors that play into priorities.
Yeah, certainly. I think what would be really helpful is if parents and teachers start asking, like, for instance, when a parent finally finds a daycare to put their child into, hey, have you tested for radon? We supplied letters with the results to the daycares and encouraged them to inform their customers of this freely available information. But I think the only one I knew that was ever informed was one that was something like 47 becquerels per meter cubed, and they taped it to the wall. But the ones that were in the thousands, I don't think they informed their customers. It would be nice if school board and school workplace health and safety folks, whether it be the parent advisory committee, whoever, started asking their school administration. Jim mentioned a few minutes ago that they informed the parents of the results in the Newfoundland school district. We sent letters to our school districts, 17 of them, asking them to please forward these to parents and staff, but it's all over the map. Some of them posted it on their net that we were doing testing, and others just zipped it, didn't want anybody to know. So we need to move past that.
Jim, do you have any comment? I know that you emphasize the importance of that early transparency in your experience.
Yeah, we communicated up front that we were going to do the testing, and that really didn't get anybody's attention whatsoever. It didn't really mean anything to anybody. Once we did the first round and we communicated, and particularly when there was a few high results, and I know Greg mentioned before about having trouble getting buy-in from some of his school boards. Yes, I at the time, we don't have a board anymore, but at the time I was the school board. So I bought in. So we would write the form letter and give to the principal and say, this letter is to go out to everybody in your student information system. So it wasn't an optional. We didn't ask. It went to everybody. And then from there, like some staff people contacted our OSH regulator, and that's one of the things I meant to mention in the presentation. I had gone to our OSH regulator up front, which was very beneficial after, because then when an employee went to a regulator, they said, well, they're doing more than they have to. They don't have the test, so you shouldn't be complaining about it. You should be happy that they're doing it. So it was a mixed reaction. People are uncertain, but nobody could fault us. I will say that in our favor. Nobody could fault us in the transparency. If anything, we over communicated.
Yeah. Well, and I know we had the opportunity with support from Health Canada some years ago to do a small Vanguard sort of project with a few childcare programs in Winnipeg. And actually the local radon mitigation company, I just asked him and he said, yeah, we'll do it really at a reduced rate if anyone tests high, just to take that scary bit away from those who are participating in our pilot. And I think recognizing that as schools and childcare start to test and you build that awareness in that educational setting, that knowledge then transfers home and into the community and can start to really promote radon testing in homes as well, which is, as Kelly pointed out, is most of the hours when we're breathing indoor air, especially for young kids. So that's an important thing to think about as well, is that spillover into the home environment. And of course, when it comes to childcare, lots of childcare happens in homes. So there's that direct overlap. I know a few of you mentioned briefly the sorts of things you can do as interim measures to allay concerns and to improve or mitigate radon levels in the meantime while the gear up for perhaps a remediation installation is happening. Does anyone want to speak to that? I know that's going to be the sort of question that comes up, particularly for smaller scale operations, you know, smaller childcare programs, for example. What can be done, especially if you're located ground level or basement? Kelly, I'm going to kick it to you to get that started.
Yeah, I figured. Yeah, for larger scale buildings and schools, their ventilation systems are much more extensive, and you're able to control ventilation in certain sections of the building. And often in school testing, it's not the whole building that tests high, but parts of it or certain rooms. And so and Elise spoke to this a little bit, you are able to monitor and control. And it becomes interesting because the ventilation systems are controlled, so they may be turned off in the evenings and overnight, and you would see radon levels increase quite significantly, but then the radon levels with the ventilation systems on are lower. So adjusting that where you can, it certainly can have a significant impact. That's not the case in small home daycares because we don't have that type of ventilation control. Opening windows, as long as it's not in the middle of winter, of course, there's considerations for that, but opening windows for a short period of time can help reduce the radon level. And remembering that the risk is long-term. There's a reason why there's 1 year and 2 year time frame recommendations for mitigation. There is time. So the risk short-term is small. So it's reminding people of that as well, but certainly increasing ventilation by opening windows and stuff can help.
So thank you, Kelly. So moving over to some of the Q&A, and I see that many of them are getting answered. So for those following along, please read the response that our panelists are typing in. Greg, you're answering the one about the duration of the test kits. You mentioned the 3 months, and I believe that's still the recommended approach from Health Canada. Someone else is asking, Elise and Jim, you both mentioned that you had support from public health with your testing. Was there funding provided for them, or did you have to self-fund projects in your province? Do you each want to give a brief reply to that as we approach the top of the hour?
So in Newfoundland and Labrador, it was essentially under school maintenance. So my overall responsibility in the world is the maintenance of schools. So it just came out of the school maintenance budget. It wasn't a separate budget from any particular place to do this. It's just another piece of the pie.
Yeah, and for PEI, we do have a smaller lot of schools, and I do know that. So they did provide us some of the detectors to kind of get us started. So that's been something that, again, we were kind of more responsible for any any mitigation systems or any follow-up, but they did kind of make that agreement with us just in the kind of to initiate the project, or to initiate the the testing for us. They kind of worked with us that way.
Great, thanks. A question for you, Greg. Can parents request the results from the school boards? Do BC schools have any obligation to provide results?
Yes, when we get asked, we direct people to their school district, or to if it's an independent school, the school operator. And yes, I've had some back and forths on, hey, I've asked and I'm not getting it. And then generally it's successful. But in my view, this should all just be posted on our outside net. It's freely available information. Anybody can ask for it, and they should get it. And I might add, any school that's tested high, and I've been invited to public meetings, it hasn't evolved into hysteria. The openness and transparency is key. What really results in hysteria is what happened in Portland, Oregon, where the lead in the drinking water and the radon in the schools tested high, but the parents weren't told. That's what gets people frustrated.
One last quick question here, and Flora, tell me if I've missed any that are, pertinent to schools and childcare. Kelly, just very briefly, you get this question a lot. Is Health Canada looking at all at getting in line with the WHO 100 becquerels standard in the foreseeable future?
Yeah, and I did answer it.
Oh, you did. I'm sorry.
Yeah, that's okay.
Okay.
I'm happy to. So we meet with the Federal Provincial Territorial Radiation Protection Committee on a regular basis annually. And most years we discuss the radon guideline level. At this point in time, the decision has been made for a number of different reasons to maintain the guideline level at 200, be clear about the fact that it isn't a safe, the messaging that there continues to be risk below it. But if you dig further into the World Health Organization's guidance, their recommendation is actually for existing programs that are within a guideline level of 100 to 300 to continue if they have an established program and focus on increasing testing and increasing mitigation. So that's really what we're focusing on with our national radon program.
Great, thank you so much. So, Flora, I'm feeling like we've probably, with the help of our panelists typing away live here, I think we've addressed most of the questions. So we are.
Can I say two things really quick? Because there were questions that I didn't answer, but levers, so the Canada Labor Code is in the process of being updated. Someone asked, oh, is it official? It'll be official online shortly. I'd have to follow up with them. You can do the same with Labor Canada if you would like. It's going through consultation, but it will be updated. That is a regulation and requirement for federal buildings. But often is what is referred to and used by other public buildings as well, and provinces and territories. So that would be a lever. And the other one, we talk about the risk to children, and for all of us, that has a lot of meaning and a lot of importance. But from a legal perspective, the protection of staff and employees is a lever for sure. So getting employees and workplace health and safety for the people working in these environments is another lever that can be used to motivate action to reduce radon levels in a building.
Yes, excellent. Thank you for that. That's really helpful. So I am going to draw this session to a close, and I just noticed that somebody wrote basically what I'm feeling. So I'm going to read out this person's contribution. I extend my sincere gratitude to all of you who persistently champion the cause of radon awareness and mitigation in your respective roles. Your dedication is invaluable in safeguarding public health. Thank you, and I would add, and safeguarding our children. Fantastic job, panelists. Thank you for all of your expertise and for your efforts to move this work forward. And for everyone who is with us this afternoon, this is the first of 4 events in our speaker series, all of which focus on indoor air quality and its importance for children's well-being and learning in their schools and childcare programs. So please check out the website, healthyenvironmentforkids.ca/held, HELD, Healthy Environments for Learning Day, to register for the other events that are going to be addressing ventilation, filtration, the effects of climate change on indoor air quality in schools, and wildfire smoke, extreme heat, etc., as well as one that's focusing on the way that pollutants can affect neurodevelopment and children's learning ability. So please join us for those events, spread the word, and really kudos to all of you for championing this work. And together we can make significant progress towards our shared vision of healthy learning environments for all children in Canada. So thank you again, merci beaucoup, and thank you to all of our panelists.
Thanks.
Thank you, everyone.
Yes, thanks.